How does special education affect the district's budget? What financial support does the district receive for its special education programs from the state and federal governments? And how does this affect our program? And the first person is Camille.
We get money from both the national and the state level, and obviously county-wide. What's unique in the past 2 years is that the governor actually changed, well, not to get into the details, but effectively what happened is that while the county at one time was responsible for the mental health needs of students, now our district is responsible for the mental health needs of our district. This has changed how we do business, and it will roll itself out in the next few years. These things don't happen overnight. One of the things that we do is that while we get about $1 million to help the emotional needs or the mental health needs, it probably costs us $1.6 million to cover these needs right now, and that's just at this point in time. It appears that it's going to be more expensive to that. However, we have an obligation, and so we've hired additional staff. We've hired a new director, and we've hired additional staff in order to meet the needs of our students. The upside of this, even though it is more costly, is I think more needs of more students will be met by having these services in-house. So that's part of the financial aspect of recent developments.
Ken?
As Camille points out, there's this fundamental fact that we receive less in support of special education services than we pay. And so that means that it's important that we use those resources wisely because we have a limited pool. And I would point to two areas where I think it's important that we do that. The first is in addressing the area of disproportionality. The fact that we have such large proportions of our African American and Hispanic students receiving special education services that they don't actually need, because presumably not all of those students are actually suffering from disabilities, means that we are expending time and attention and dollars on services that are not required for those students, and they're actually leaving them worse off than were they simply in mainstream classes or not subject to special education. And the second consequence of that, obviously, is that those funds are not available to be used elsewhere. And this is why, in a sense, RTI is the silver lining of our response to the disproportionality issue, because moving kids, diverting kids from special education both saves money, but it also leaves them in a much more educationally appropriate context than if we brought them into the special education system when that's not required.
Thank you. Melissa? Well, so in addition to the mental health services, obviously we get money from the state and federal government. And that money helps us pay for our special ed services, but it doesn't completely pay for them. It's really important that we realize that not spending enough money to do special education correctly actually has a downstream higher cost for our whole society. And so it's more costly for our school district later on. It's also more costly for our community, for our city, for our country. And so it's really important that we make the right investments early on so that we don't have those later problems. It's also important for our students that they can be contributing members of our society. It's important that we set them up so they can be successful. I said before that we've moved from kind of a deal-by-deal special ed to one that's more consistent, that uses our money more effectively, that allows us to set standards. We also need to do things. I know that when I went in for accommodations for my child, how difficult it was to get that information. We need to put some systems in place for accommodations and interventions that work, that are shared across the district, so that no one has to do as much work as we've been doing in the past to figure out what those are. And so there are a lot of efficiencies we can get, but still, we're going to have to make an investment if we want to make sure that we're not creating a cost down the road for our community and our students. Thank you. Heidi?
So special education funds are provided by the state and federal governments under categorical funding. Governor Brown has recently threatened to remove or consolidate categorical funding. This is a big danger to special education programs, and I hope you're all aware of that and are writing letters to Governor Brown. I go every year to advocate for Early Learning Advocacy Day in Sacramento, and it's a great experience to go and lobby those senators. This year, several studies, including one from the Center for Disease Control, estimate that 1 in 88, or depending on the study you read, 1 in 110 children now fall on the autism spectrum. 1 in 110 or 1 in 88. A study released last month put the annual cost of autism in the U.S. at $126 billion, more than triple what it was in 2006. The bulk of those expenses are for adult care. In our district, we offer several post-secondary transition programs, which are rarely talked about but do exist. And I think we need to raise community awareness around these programs and support district funding for these essential resources, ensuring that every student has a viable post-secondary plan.
Thank you.